Hello, I'm Dr. Emily Blumberg, the Director of Transplant Infectious Diseases at the Penn Transplant Institute. Today I will be joined by my colleague, Dr. Kathleen Murphy, another transplant infectious disease specialist and the Associate Hospital Epidemiologist at the Hospital of the University of Pennsylvania. Today we're going to be talking to you about COVID-19 and answering the questions that have been posted on the Penn Transplant Institute Facebook page. I'd like to start with telling you a little bit about what COVID-19 is. COVID-19 is an infection caused by a new virus that was first identified in Wuhan, China in December 2019. Mostly, it causes a respiratory illness characterized by flu-like symptoms, cough, and sometimes shortness of breath. It spreads easily from person to person and has been found throughout the world and in all 50 states in the United States. Many wonder if they're at risk for COVID-19, and there are several things that may be associated with a risk for COVID-19. The first is travel within the past 14 days to an area where there's COVID-19. The second is close contact with someone with COVID-19. But if there's COVID-19 in your community, you may still be at risk regardless of whether you've traveled or have had direct contact with someone known to have COVID-19. There are a number of things that you can do to protect yourself from infection. The first and most important is to avoid close contact with people who are sick. Be sure to cover your cough or sneeze and instruct those who are around you to cover theirs. The best way to do this is to cough or sneeze into your sleeve or into your elbow or into a tissue, which you then promptly discard. If you or your household contacts are sick, they should be staying home, and you should stay home if you are sick. Avoid touching your eyes, nose, and mouth with unwashed hands, as the eyes, nose, and mouth are the ways that this virus can get into your system. Be sure to clean and disinfect frequently touched objects in your home and in your workplace. This may include things like cell phones, computer keyboards and mouses, and surfaces in your home that you may be touching frequently. At this point, the CDC does not recommend the use of surgical face masks for people who are well. However, recent guidance suggests that cloth face coverings are recommended to actually protect you further from the spread of COVID-19. You want to be sure to wash your hands and practice good hand hygiene. This can be done in one of two ways. You can either use an alcohol-based hand sanitizer with at least 60% alcohol, or you can wash your hands frequently with soap and water, washing them for at least 20 seconds when you do so. Additionally, it's very important to stay home as much as possible. It's very clear that social distancing can help us stem the spread of this infection at this time. As I mentioned before, surgical face masks should be used by people who show symptoms of COVID-19 when they're around other people. But for those who are well, the CDC now recommends cloth face coverings when you go out in public. And you can learn how to create your own face covering at home using directions on the CDC website. Please contact your doctor to make sure you have an extra supply of your regular prescription medicines to have on hand. Ideally, you want at least a 30-day supply at all times. If possible, ask your doctor to write for 90-day prescriptions. Be sure you have the over-the-counter medicines and supplies you may need at home. These would be medications and supplies for treating fevers and other symptoms, things like acetaminophen, tissues, things of that sort, and be sure you have a thermometer to take your temperature. Have enough household items and groceries on hand so that you will be prepared to stay at home for a period of time. Remember, social distancing is an important part of preventing the spread of this infection, so you want to avoid crowded stores. If at all possible, have someone else shop for you. And at all times, remember to wash your hands frequently, especially when you come in from outside. Should I wear a mask? Well, it's important to recognize that the N95 mask should be used only by healthcare professionals. This requires testing to ensure the proper fit. Use of this mask is not recommended by the CDC or WHO to prevent infection for the general public. The surgical masks, similar to those you see people wearing in the hospitals, may be commonly seen within hospital or doctor's office waiting rooms. These are recommended for community use to prevent spreading germs to others via coughing or sneezing, and so for people who have symptoms, this is the preferred mask to use. It will not, however, 100% prevent someone from getting an illness from other people. It can prevent one from touching their mouth or nose with their hands, and you should certainly talk with your provider about whether you should use this type of mask as opposed to the face covering recommended by the CDC for people who are well. Many people have asked us whether or not they can go to work, and this really depends on what you do for work. Whenever possible, we want you to work from home. And if you need to go to work, there are some things we're going to want to know to make sure that we can do this safely with you. We want to know, what's your work environment? Are you surrounded by a lot of people? Would you be exposed to potentially contagious individuals? Is there any opportunity to work from home? If you're concerned about your work environment, please talk to your provider to determine how to make it safer for you to go to work, or else to provide a note to excuse you from on-site work wherever possible. Many people ask us how they would know if they actually were infected with COVID-19. It's important to recognize that even in transplant patients, the symptoms are highly variable from person to person. And we think that even some transplant patients could have this infection with minimal to mild symptoms. In most cases, the symptoms are very similar to colds or flu, and people have present with fever, cough, and an achy feeling. Sometimes we've seen that patients are having stomach upset and or diarrhea as the main symptom of their infection. A minority of patients are getting severe pneumonia and breathing problems, and if that's occurring in your situation, you must report to the hospital. What should you do if you think you have COVID-19? The first thing to do is to call your healthcare provider to discuss your symptoms. In order to protect you, all those around you, and the healthcare system, you should never show up unannounced at any venue. Rather, you should call your provider, who can then determine what the optimal management is for you. And if you do need to come into a healthcare environment, they will give you advice on the safest way for you to be tested and to get care. There is a need to call 911, however, if you develop difficulty breathing, lasting pain or pressure in your chest, new confusion or an inability to be able to stay awake, or any bluish discoloration of your lips or face. If you live outside the Delaware Valley and you need to be hospitalized and you have these symptoms, you may be instructed to go to your local hospital for care, as it may take too long to get to the University of Pennsylvania to treat you in the best possible way. What are the treatments? Well, at this point, there are no specific medications that are routinely used to treat COVID-19, and most treatments are still aimed at treating the symptoms. We are, however, investigating in the use of some medications, either those that are available currently but are being used as part of studies or for compassionate use, or in an off-label indication. it's important to recognize that even these previously approved medications have not been approved for the treatment of COVID-19. So we have insufficient data to know definitively whether these are the right medications for any individual, and that is why we're doing them in observed situations. In some cases, there are new investigational medications that may be used and have encouraging results. And certainly for hospitalized patients and for specific other patients, we are potentially getting access to these medications both here at the University of Pennsylvania and in other hospitals throughout the United States. If you are sick, you should definitely call your provider so we can determine the most appropriate management of your infection. We've been asked a lot about what to do with people's regular medications, and especially immunosuppression. If you are symptomatic, do not stop any of your regular medications, especially your immune suppression, without talking to your provider first. To develop rejection at the time of this infection could complicate your treatment, and we certainly want to be thoughtful in how we manage all of your medications. What about if you've been exposed to COVID and you don't have any symptoms? Please let us know that you were exposed. If you are living with or have daily contact with the potential contact with COVID, we want you to separate yourself to the best of your ability. Either they or you should be completely separated in the household. Make sure you're washing your hands with soap and water or use a hand sanitizer frequently. And of course, avoid touching your eyes, nose, and mouth with unwashed hands. You should avoid sharing household items with the patient. This includes things like bathrooms if you are able to avoid that. Please remember to clean all high-touch surfaces, such as counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables every day, because these surfaces may be the way that the infection can be transmitted. All laundry should be washed thoroughly, preferably at higher temperatures. What should you do about upcoming doctor's appointments? Well, our first priority is always the safety of our patients. And so in some cases, we are going to be recommending phone or video visits instead of coming to the University of Pennsylvania for your visit. Your provider will let you know which type of visit is best for you. If you are told to come to Penn, we will discuss with you in advance what precautions you should take. Please be aware that in the near future, we will be doing temperature checks on individuals entering the outpatient facilities at the University of Pennsylvania, in addition to those entering the inpatient facilities. What about lab work? Well, despite the fact that we're trying to ask people to stay at home, you may still need lab work, and we may recommend going to your local lab or having a home blood draw instead of coming here to Penn. Regardless, if you are going to either the lab here at Penn or your local lab, please make an appointment before you go to the lab to make sure you do not have to wait. While waiting, please make sure to stay 6 feet away from others at all times. What about if you've had COVID and you're now recovering? Please do not leave your home until you are feeling better, unless your provider says it's safe to do so, and check with your provider before you leave your home. It's important to recognize that, as with other infections, transplant patients may remain contagious longer than other patients with COVID-19. So we do want to be careful and make sure you don't transmit COVID to other people. For that reason, it will be important to touch base with your providers to try to determine when it's safe for you to leave. Now, I'm going to be asking Dr. Murphy some questions that have been submitted to Penn Transplant Institute on the Facebook page. So, Kathleen, are post-transplant patients more than 10 years out at higher risk secondary to prolonged immune suppression?
Thanks, Dr. Blumberg. This is a great question, and my initial answer would be that we still are learning a lot about the virus and how different people are infected, including transplant patient populations. So, I think that we do have a sense that some degree of immunosuppression will put you at potentially higher risk of contracting and complications from the virus, but we just don't know through a lot of studies and information that we have now yet, and whether that is different when you're just right out of transplant versus many years down the road. So I would say everyone should be taking the precautions that Dr. Blumberg outlined. And as we get more information about what this virus looks like in patients who've had recent or are longer out from transplant, we'll make sure to share with you all.
One of the common questions we get is what to do about food. What food safety precautions should we add? Should we Lysol everything before bringing it into the house, such as containers for food, milk jugs, or other items?
Also, another good question. I think one thing to ask about food safety as well is if there's a possibility to have someone else in the home or a friend or contact do food shopping for you, that can be one way to avoid you even having to go into a group setting like a grocery store. When you come home, I would just be extra careful to wash your hands. And I do think it's reasonable to be cleaning either with soap and water or Lysol or another sanitizing wipe, things that you bring into the home if they're able to be wiped down on the outside. For example, a carton of milk. But your normal food preparations in terms of washing things like fruits and vegetables before you eat them and cooking your food does not need to change. And overall, we are not as worried about things that would be tracked in on the surfaces of food, for example. But we do know the virus can live on things like plastic and metal. So if you're able to wipe things down before you put them away, I think that's a good idea.
Great, thank you. Does the virus stay on clothing? What surfaces does it tend to stick to? And what surfaces does it not like? And what do I do about the pets? Can pets transmit the virus to humans?
We are getting a lot of questions about this. So we don't think that the virus stays alive or transmittable well on surfaces like fabric, but as I mentioned, it does seem to have a particular affinity to plastic and metal in some recent studies. And we do think that it could potentially be on surfaces like counters and doorknobs that you come into contact in your home. So I think wiping down and keeping clean all high touch points in your home, doorknobs, bathrooms, sinks, counters that you touch is probably the best thing to do. And then I would just do your normal laundering of your clothing and bedding and towels. And I don't think you need to change anything specific related to that. The question of pets is good. We do think that this virus originated probably in animals, most likely bats, but we haven't found any evidence that household pets like dogs or cats can be infected by the virus. That being said, I would keep doing good hand hygiene as you take care of your pets after you pet them so that you can protect yourself and your pets.
Great, thank you. When should a transplant recipient engage their care of their primary care provider or their transplant team? Can you give guidance for who you should talk to first, perhaps?
So I think the most important thing is that you let a provider who knows you well and knows your situation in terms of your transplant, your medications, know right away when you're not feeling like your usual self. As Dr. Blumberg mentioned, some of the symptoms of COVID-19 can be different in different patients, and we are seeing some presentations of this illness, for example, people who have nausea and vomiting rather than the typical respiratory symptoms in transplant patients. So I would say, I think it's a good idea to let your primary care doctor know if anything feels off to you, whether that's respiratory symptoms or shortness of breath, things like cough, if you have a fever, or even any diarrhea or nausea that's not normal for you. And then I would also make a call to your transplant coordinator right away, because I think that group in all will have a sense of your specific situation relative to your transplant. So I think it's important to let both of these teams know.
And you should be aware that we in infectious diseases are providing backup for the Transplant Institute, both with virtual visits and guidance on patients. So your transplant coordinator and other providers will always have the reassurance of knowing they can work with us, and we will be able to see some patients virtually as well. Is there a risk that transplant patients could have coronavirus but not show symptoms and potentially spread the virus? This is a great question, Kathleen. What do you think?
Agree, a good question, and one that we're hoping to have more and more information about as some more research comes out in basically asking this question, is there a period of time before people have symptoms when they can spread the virus? And then also, is there a group of people who never really have symptoms of the virus but are still infected and could potentially spread it? And I think the answer is that we do think this is the case. We think that there's some people who, in the days leading up to having things like a fever or a cough, are still shedding the virus so that it can be transmitted. And we also think there are a group of people who either have very, very mild symptoms or almost no symptoms and still are infected. And so we need more information from studies of our population, for example, looking for immune memory to the virus, to really understand these things. So what I would say is that I think everyone should be taking caution at all times in terms of good hand hygiene, keeping your high-touch surfaces clean in your home, avoiding being out in public or in really any setting where you're around other people, so that you can protect yourself, and really, just be careful in that setting. And then I think if you are found to have COVID-19 or someone who you are in close contact with has COVID-19, then that's a very important time to engage your transplant care team, because we have specific advice for what to do in that setting to try to make sure that we're monitoring you closely and also preventing spread to anyone else who might be in the household or everyone might have had contact with.
Great, thank you. So it's always good to remember to take your usual precautions, and that should help. Should transplant patient household contacts also not leave the house? What do you think?
I think that this is a difficult situation to, be in, for example, because there is going to be some need for people to do things like go to the grocery store. And some people really do need to work outside the home. They have an essential job where this is important. So what I would say is if you have contacts that need to leave the home, they should be trying to social distance as much as possible. They should be doing good hand hygiene. They should be wiping down things in their office and workspace and washing their hands before they come back into the home. Everyone should be monitoring their symptoms. And then we are happy to discuss on an individual basis with any one of our transplant patients who has certain concerns, especially if there's someone in the home who has to be outside the home for work reasons or other reasons, because there are certain situations where this is unavoidable. And I think as long as people are vigilant about their symptoms, washing hands, and taking good care when they come back home in terms of protecting others, this can be done safely.
Great, thank you. So this gets to something that you were just talking about. We know that many of our transplant patients live with individuals who are still required to go to work. In many cases, their work may involve interacting with other people. For example, going to clients' houses for specific services, or potentially working in the healthcare setting or police or firefighting, things where we know that they may have a greater risk of exposure. This is clearly an area of concern for many of our patients, and I think it would be helpful, Kathleen, to share some guidance with them about what you think they could do to help mitigate this difficult situation.
Of course. And, I appreciate, again, like I was just saying, that there are some situations where someone in your household's job really mandates that they can't stay home and they're needed for other public services or even other healthcare jobs. So one thing I would say is if you feel like someone in your household is going to be at a particular higher risk situation, or they can't control exactly who they interact with, or the types of groups they're interacting with, one option is to try and practice social distancing in your home, which means trying to stay 6 feet away from other people in your home and do things like sleep in different bedrooms, use different bathrooms, as well as your usual attention and care to wiping down surfaces and washing hands. And that's not feasible for everyone, but that's just one idea of, again, trying to make sure if you're in this situation that you're protecting yourself to the most of your ability. We have had conversations with individual people who have made accommodations, for example, to stay with relatives or other people. And I just think that there's going to be a different situation for everyone. So again, we're happy to help talk through your individual situation. The most important thing you can do is be really careful about washing hands and cleaning surfaces in home and having your household member or close contact, if they do have to be going out and doing jobs in the community, also being really careful about hand hygiene and their hygiene practices when they're at work. But this is a really difficult situation, especially for our transplant patients who do have household contacts with a lot of potential exposures outside the home.
And of course, if your household contact starts to develop any symptoms whatsoever, please be sure to separate from them in terms of either if one of you should be moving out of the house or take other precautions so that you're not in contact with them, especially until you know whether or not they have COVID.
Absolutely. And I think that's another great time to let your transplant team know so that we can go through some of this advice with you in more detail.
And I think this really covers the question of what they should do if they live with one of those individuals. So we got this question from a lung transplant recipient, but I think that many others may relate to it. This individual said that they were sequestered as they understand the inherent danger of the virus to them in particular, but they're getting a little cabin fever, and they're wondering, how long do you think they're going to need to stay at home?
This is a good question, and we're getting this from everyone, not just transplant patients. I think it's difficult for everyone to sort of be in this situation of limbo and wondering when things will change or when we'll have more information. And what I would say is, at this point, we just don't know. I think the safest thing for everyone is to stay socially distanced for right now and avoiding, going into big group settings. And as you know, a lot of the businesses and other things in our communities based on government orders, are also sort of on pause. And I think that really is the safest thing and the thing that needs to continue for now. We've seen various models in our area about when our cases of COVID-19 will peak. These have really ranged, in terms of prediction, whether this is in April or May or even longer. And, I think that we are at the point where we have some data models, but we just don't know. And we're getting more information every day about how effective our social distancing has been to help prevent the spread of the virus. So more to come for that. But I would say, at this point, we are going to be in this situation of continuing our social distancing for at least the next few weeks and more to come.
Yes. And so be reassured, we do think this won't be, indefinite, and there will come a time when the virus will decline to the point where people will be able to leave their homes and resume their activities. But I think that the most important thing we can all do now is to continue to stay at home, encourage our family members to stay at home so that we can stop the spread of the virus. We do know that social distancing makes a difference. We've been asked a lot about what temperature should someone with a suppressed immunity be looking for medical assistance. Transplant patients may not have the standard fevers that others have. So what do you think would be good advice on this, Kathleen?
I think that what the best advice would be, you all likely know where you normally live in terms of your temperature. And so if you're more than a degree higher, or you have anything like chills or malaise, which means just kind of like fatigue and generally not feeling like yourself, that's a good idea to check in with your transplant team. We are using a cutoff of about 100 for the general population, but this can be very different in transplant patients. And what I would say is if you're more than a degree above where you normally live, check in with your team.
Good advice. This patient said that they're almost 5 years after kidney transplant and they're due, well, this was at the end of March, but certainly it applies to people who are due in April for routine labs. They want to know if they can postpone this till later. What do you think?
So I think that's going to be an individual decision between you and your transplant team. There may be a reason that they would like to see these labs, especially if they're monitoring something like your drug levels or your kidney function or your liver function that they need to see. It might be okay to delay them a little bit. And as Dr. Blumberg mentioned, there are ways that we can make the process safer for you to get labs, whether that's scheduling an appointment or in some instances, having the ability to have someone draw them in your home, for example. So that can all be a discussion with your team. but we want to make sure you check in with them so that they make the best medical decision for you about whether it's safe to hold off for a month or so and get this blood work done.
And this is a good example of something to think about in terms of, we don't expect you to make all your medical decisions yourself. We want to work with you as your care team to make sure for each individual we're using good judgment to decide what appointments are needed, what labs are needed. We all have your safety at our top priority, and so please reach out. What about this one? Should I take the chance and go to my transplant center for my 6-month check?
I think, again, this is a question between you and your transplant team. We're able to move a lot of our appointments to virtual visits, which has worked really well. And so this is something that your team will navigate with you. If there's a reason that they need to see you in person, for example, for something related to an exam they're doing on you, that will be an individual discussion. But we have successfully been able to see a lot of patients virtually, which, as long as we can make sure you have a phone or a computer that we can do this through, has been a really nice alternative. So you can still check in with your team and have that in-person conversation, answer questions and review things, and just avoid the in-person experience and having you come into the healthcare setting. But again, if it's necessary and determined by your transplant team that they really need to see you in person, we have a lot of procedures in place so that you can enter the healthcare setting safely and stay safe while you're here, and that we protect you, while you're in the clinic and all of that.
Great, thank you. What about elective surgeries? Can those proceed?
So here at Penn, most elective surgeries are currently being delayed until it's a safer time for people to be in the healthcare setting. But if I were you, I would call your surgeon's office and your transplant team to discuss any surgeries that you have upcoming so we can make the best plan for you.
Thank you. What protocols can patients expect when they arrive at Penn for an appointment? Is it different for transplant patients with COVID-19 symptoms than it is for those who are asymptomatic?
So all of our patients are being screened the same way as are actually all of our healthcare providers when they're coming into these settings. So all patients, when they check in, are going to be asked a series of questions to make sure that no one at present is having any active symptoms or has a significantly concerning travel history, for example, from areas of the country or the world where there are a lot of numbers of cases, so that we can make sure that people coming into our clinics who would be around other patients and our staff are safe to do so. If anyone checks in with any concerning symptoms, they're being redirected to a safe location where they can be examined by our team, taking appropriate precautions, and further decisions are made from there. So we're being very careful, one, before patients arrive, while patients are scheduling appointments, when patients arrive, to make sure that everyone coming into clinic is healthy. And then we are doing sort of extra efforts in terms of cleaning our clinics and all our environments to keep things safe. Our staff are wearing masks now at all times to help protect everyone. And again, some of our protocols about this are trying to move a lot of our clinic visits to virtual visits so that we mitigate any risk of you coming into the healthcare setting. So not any particularly different process for transplant patients, but we really are going above and beyond for everyone so that we make sure it's safe.
And remember, it's very important, if you're having symptoms, to call your provider before you show up here so we can do this in the safest way. We can evaluate you in the safest possible way. Well, now let's talk a little bit about things that may or may not protect you. Does the flu shot protect patients from COVID?
So the flu shot does not protect patients from COVID-19 in terms of that virus itself. There's no additional protection from the flu shot. But what I will say is the flu shot is still good because we also want to make sure that you don't get the flu. And so the flu shot is still important for the flu, even though we're coming to the end of flu season. There is still flu circulating, but it is not a vaccine that covers COVID-19. So we're working on a vaccine that hopefully will be available in the next maybe year and a half, year, so not too soon. We're working as fast as we can on that in research labs throughout the country, and but we don't right now have a vaccine that protects against COVID-19.
What about antivirals? Should someone with a transplant be on an antiviral medication during something like this? Many people have wondered whether they should go back on their Valgan cyclovir or other antivirals they may have been prescribed in the past.
That's a good question. So the answer is that we don't have any proven treatments of antiviral medicines for COVID-19 at this time. There's research going on in this area about some certain antiviral medications that might work. Valsite is not one of them. The medications that you'd currently be taking for antivirals are likely not going to be active against this virus. So you should not start taking any new antivirals or go back on your Valsite, for example, at this time. And any changes in your medications, remember, this is really important to discuss with your transplant team. We really don't encourage you to be starting or stopping any medications without talking to them.
And that's really an important point that we can't emphasize enough. If you're already on an antiviral, you should stay on it unless your provider tells you to discontinue it. And if you're not, please do not start any new medications without talking to your providers. In some cases, medications have side effects or drug interactions that may impact on your health in other ways. And so we want to keep you safe. Keep the lines of communication open and talk to your providers about any medication concerns. What about vitamins or supplements? People talk about vitamin C, echinacea, zinc, things that are immune system boosters.
So we also don't have any proven evidence that any of these types of supplements help against COVID-19. If you're already taking them, that's fine. But if you're going to start any new supplements or vitamins, please discuss with your transplant team.
Okay, how long do I need to quarantine away from my family member if the family member has tested positive?
Another good question. So the current advice is that you quarantine away from your family member for actually 14 days from when they're released from isolation. So when they're feeling well enough and they have had enough time to be cleared actually by the Department of Health that they're okay to not be isolated anymore, then the clock starts on your 14 days staying isolated from that person. So it's a little bit complicated, and what I would say is the Department of Health and your doctors will be helping you figure out these timelines.
Great, thank you. What about tacrolimus levels? Do they correlate with a greater risk of being infected with COVID-19?
So I don't think we have any data on this question right now. This is still a lot we're learning about how this virus behaves in the transplant population. And we do think that people who are immunosuppressed are at higher risk potentially for more severe disease, but we don't have enough data to say specifically if that has to do with your drug levels or the types of immunosuppression you're on. So more to come, but we just don't have enough information right now about this question.
Great, thank you. I know that people are very anxious about this virus and they're very worried about what will happen to them. This patient asked if they would die if they got the virus.
So I know that this is a very anxiety-provoking time, not only for the general public, but especially for people with conditions that suppress their immune system, like you all as transplant recipients. And what I would say is the majority of people who get this virus have fairly mild symptoms and are able to recover at home. We do suspect that people who do not have normal immune systems may be at higher risk for more severe disease, but we need more information about that. So I want to reassure you all that the best thing we can be doing is to protect any of you from coming into contact with the virus. If you do end up contracting the virus, we will work very hard to make sure we're helping you with anything we can in terms of monitoring your symptoms, getting testing, deciding if you need to come into the hospital or not, and really navigating this whole process with you. We have a lot of teams who are working really hard to take excellent care of our patients, whether that's at home or in the hospital. We have had, we've already been taking care of transplant patients with this virus who have left the hospital. So we are actively, working on this process. And I just want to let you all know that the majority of people who do get this virus recover, and that we will work our absolute hardest to make sure that anyone who does get infected has the support and the care that they need.
Yes, and I think we're starting to learn from other individuals throughout the United States that the majority of transplant patients who get the virus really do okay. So if you get sick, we will support you to help get you better. Who should transplant patients call first if they have COVID-19 symptoms? Their primary care provider or their transplant coordinator? And this we've been asked before, but I think it bears re-mentioning here.
I think the answer is both would be my answer. I think your first call should be to someone who knows you well, is immediately available, and can get back to you in a timely manner to help assess your situation and your symptoms. A lot of you have very close relationships with your transplant coordinators who can immediately connect you to your teams here. And I think that, we want to have a higher threshold for a lot of things related to your patient population. So I would advocate that one of the first people you reach out to is your transplant coordinator, and that you also let your primary care doctor know, especially since for some of you that may be your local, more local to you in terms of if you need some immediate assistance than your transplant team.
Right. That makes sense because some of you really don't live close to us, and we want to make sure you get timely care in the best possible location. Kathleen, how long do you think this is going to last? Are we going to be talking about COVID months and months from now, or do you think we'll be able to put it in the rearview mirror?
This is a good question. I think we're going to see surges of cases in the U.S. in the April to May range, and then as we expect with this pandemic, cases will wane after that. I think one of the big questions is, are we going to have another surge of this virus in the fall, or when we start to lift some of our isolation policies? And I think that is still a question. And then the other thing is, sometimes if there's enough of this virus and it's virulent enough, it can become one of the circulating strains in terms of what people present with seasonally, much like the flu. So I think a lot of that we're still figuring out. I think this current situation, again, we still think we're not quite sure where the peak will be. Will that be later in April? Will that be in May? And we will, as Dr. Blumberg said, see a reduction in cases and be able to return to more normal life. But I think a lot of the questions about how do we protect ourselves from another surge in the virus, will there be a seasonality to COVID-19 that continues to affect us, are all still to come. And then really what we need to be working towards is a vaccine so that we can provide some, protection for the population in all of these cases.
And I think it's reassuring to know how many people are working on solutions to all of these, so that we hope if the virus does come back that we'll have more access to rapid testing, so we'll immediately be able to identify people at risk for spreading infection and be able to contain the infection early on. We also hope we'll know a lot more about what medications may or may not help patients with the infection. And of course, the development of a vaccine is foremost in everybody's mind. And every day we hear about new clinical trials about vaccines. So we're hopeful that there'll be a lot of good information about prevention. We know that many of you at home want to help. And one of the things that's come up is whether or not it's worth it for you to sew masks and donate them to the hospital. What do you think?
So we currently have enough face masks, surgical masks, but we're monitoring our supply very carefully, and we may in the future be looking at other types of masks, for example, masks that are sewn, and we have had so many people offer to sew masks for us, and we are just so touched by everyone's generosity. And I really appreciate how many people have actually asked of ways they can help us, and thank you all so much for thinking about your teams here. I know they really, really appreciate it. So we will keep you posted. If we do need these types of masks, we would love to receive them from any of you, and we've gotten a lot of requests of this. So we may be asking for the community to help in this way, but right now we're okay with the number of face masks that we have. But thank you all so much for thinking about ways to help us. It really means a lot.
And if we do come to you and ask for these, we'll give you some guidance about what to do to create masks that will be safe for the use by healthcare providers. So thank you very much. Well, that concludes our webinar for today. We will continue to take questions on our Facebook page. If you haven't signed up for My Penn Medicine, this is an especially good time to consider doing so, as that turns out to be a great way to share information with your transplant team and for us to share information with you. Even if we're not present in the hospital, we're all checking regularly our Epic inboxes and connecting with our patients. So please sign up for My Penn Medicine if you haven't done so. And please contact us with any questions you may have at any time. Remember, here at Penn Transplant, we are here for you and looking forward to better days with you all. Thanks very much.